But we had for a couple of years instituted processes in Sekhukhune to monitor the HIV prevalence in the area. And we picked up Makhuduthamaga municipality as a sample. And what we did in that municipality, we made sure that we put up what we'll call health councils and HIV/AIDS councils, but also partnerships with the traditional healers, who are actually the support systems for patients.
Now, and
we did a research which then continuously we were collecting numbers in terms of what is the prevalence in the area of infectious diseases, including HIV/AIDS.
Now, there are always campaigns about good sexual behavior, Max, but what is different about this one, though?
What is different about this one is that when we roll out this campaign, we make sure that we invite the public also to participate in testing and counseling campaign. I can tell you that yesterday we had over 299 people who actually volunteered to undergo testing and counseling to know their status, because we encourage every South African to conduct HIV/AIDS screening at least twice a year. We also did other tests which for TB and sugar diabetes. And that process on its own help us also to look at what are the areas where we need to put interventions and make sure that we accelerate our treatment programs.
So would you say that your response from the community has been encouraging and positive?
I should say we don't celebrate mediocrity, but we want other municipalities to come to Makhuduthamaga, even other districts in the province, because there has been a steady decrease on infection, HIV infection in the Makhuduthamaga since 2007. In 2007, the municipality was sitting at 21.8% infection rate. As we are talking now, we're sitting at 16.8%, a huge decrease. And young people in the area, any other sexually active person, they've taken the message that get wise, get tested, get circumcised, but also at all times practice safe sexual behavior.
Now, you mentioned young people. Is that your target?
Look, we can't escape the reality that the young population in South Africa constitute almost half of the South African population. We've got over 21 million young people. And these are future fathers and mothers, future leaders. We need to make sure that they live healthy and live longer. We have to make contribution as the society and as a department also to extend life expectancy of South Africans. It pains us that it keeps on dropping, not increasing, unlike in other first world and other developing countries.
So you're educating the young people in these areas, but what else are you bringing to them to provide them with condoms or anything like that? Is that what you also do?
We're providing condoms, and we're working with other non-governmental partners. We call them health partners, who are in the agri sector, who are in the industrial sector. Through the partners, we are on an aggressive campaign to distribute condoms, make sure that they have access to condoms. But also, we are also going ahead with the campaign to make sure that females also, the femidom, because there has been this unfortunate stigma about femidom. There's nothing different about both a condom and a femidom. But we need to encourage women also to say wherever you go, in your handbag, either you carry a male condom or a femidom, so that you are ever safe.
Finally, Max, what are you hoping to achieve with this drive?
Like the society, as a South African society, we want to achieve a healthy lifestyle. We want to increase life expectancy of South Africans. We want to have a healthy population. And this is the message we want to send, because our objective is that primary health care doesn't mean that we need to have more people in the hospitals, but we should have very fewer people going to hospitals and clinics. And it starts with prevention. So this is a preventative way to reduce also the state burden on dealing with chronic diseases, and also the state fiscus on antiretrovirals. We're not saying we're not going to roll it out, but we want to reduce the infection rate, especially that we have a target to meet in 2015 to make sure that any other child who's born is HIV-free. So the prevention to mother transmission program is working, and we're working very hard to encourage mothers who are pregnant and that they must start joining what you call antenatal clinics immediately they realize that they are pregnant. So that preventative measures, if the mother is HIV or has got any other sexually transmitted infections, she gets treatment there and there to prevent further infections to the child.
Max, I did say lastly, but finally, you are speaking on behalf of the Limpopo government, but is there maybe plans afoot to roll this out nationally?
This is a program which is driven by our Honorable Minister Mtswaledi. It's the STI Condom Week. If the public is not aware, it's not a provincial event. It's a national, and the WHO took a decision that it be commemorated during this week as an international event. So it's not only happening in South Africa. It's a program that is rolled out all over the world. But we are saying, as Limpopo, we can't be left behind. We should take the lead. We are happy with our stats that there seem to be steady decrease in terms of the infection rates. But we're still worried with these other areas, which there's a huge economic growth. There's Sekhukhune area where you've got a lot of mines, and the Waterberg area also where there's lots of mines. In the Waterberg, you have in excess of 10 to 20,000 males who are in that area, who are migrant laborers from all over the country. And we are now putting up a dedicated program to deal with HIV infection in the area, because Waterberg, it's a worrying factor for us. It's sitting at 30%. We need to drop those figures.
Max, thank you so much for your time.
Thank you.
And that in our Polokwane studios, that was Macks Lesufi, the spokesperson for Limpopo's Health MEC.